What are these events?
There'll be 2 events for employees to participate in. The first is completion of Aetna's online health assessment between January and March of next year. If you complete Aetna's online health assessment, you'll receive a one-time $50 credit off of your medical premium. It's important to participate in that event because Aetna's health questionnaire gives you lots of information that's useful to take back to your doctor and discuss. You can also print off that questionnaire and take it with you. The second event is called Know Your Numbers. We'll be bringing Quest onto all of the main campuses and also have sites set up at some remote locations. Quest will give you some free biometric testing, so glucose screenings, cholesterol screenings. They'll calculate your BMI. And for participating in that event, you'll get a one-time $100 credit off of your medical premium. We'll be sending out more information about those 2 events probably closer to the end of the year. But let me ask a question. Does anyone in here know what their cholesterol or their glucose level is?
No.
Okay. That's why we really want to make sure that everyone takes action for their health, that they participate in these events and try and get healthier in 2010. We're very excited about this. Completing the questionnaire will get you the incentive and get you useful information, and participating in the on-campus testing will do just the same thing.
Who will see all of my personal information?
President Shalala was involved in passing the federal laws that prohibit employers from seeing anyone's personal health information. So the only information that the university is going to receive is information about our whole population. And also will receive information as to whether or not you completed the questionnaire, but not the responses. And beyond that, Aetna is only going to use the information to invite you into the appropriate health and wellness programs based on your responses.
So what I see from this chart, if I have employee-only coverage and I participate again next year, my total premium is actually going to be less than it was this year.
That's exactly right. That's exactly right.
Since UM is focusing on wellness, what other programs do they offer?
We've launched a new site called WellCanes, miami.edu/WellCanes, that has all of the wellness programs listed, offered by the university, by Aetna, at all of the main campuses. So you should definitely visit WellCanes to take a look at what's available. The most important program that we want to focus on first is the Be Smoke Free program. Free program available to all faculty and staff includes things like free acupuncture, Tai Chi, and other smoking cessation tools to help you get smoke-free next year. The medical campus is going smoke-free, and there will be an increase to the smoking surcharge next year. It's going up from $20 to $40 per month. Smoking obviously is very harmful to your health, so we want to make sure that everyone has all of the tools that they need in order to get smoke-free in 2010.
Well, what about classes for weight loss?
Actually, Weight Watchers at Work is probably our most popular WellCanes program, but there are others available as well. You can participate in the Shape Up program. There's a special fitness program targeted just for folks who have cardiovascular disease. So you definitely want to visit the WellCanes website to make sure you see all of the programs that are available.
Are these programs free?
Some are free, some are offered on a reimbursement basis, and some have a small cost, but all of that information can be found on the site for you to use.
I like that it's free. Considering the economy, things are really tight right now. How can we save some money?
Well, the most important thing you can do to save money in 2010 is to carefully choose your medical plan. We have information available on our website to help you do just that. Also important is to participate in all of the free preventive care that's available under our medical plan. Making sure that you use UHealth doctors and facilities when you need to use medical services because your copays will be lower. Making sure that you use generic drugs whenever you can, and using smart generic drug benefits like the new Walmart benefit or some of the other retailers that have discounted generic drugs. Also, instead of going to the emergency room for minor emergencies, you can visit an urgent care clinic or a walk-in clinic. Walk-in clinics are available, for example, in Walgreens and CVS, and if you use one of those clinics, you'll not only save time, but you'll only pay a PCP copay under our medical plans. And finally, flexible spending is a great way for folks to save money in 2010.
I've always liked the idea of a flexible spending account, but I'm really not comfortable with the concept. Can you explain it to me?
Sure. An FSA is an account that you can set up during open enrollment to put aside money on a pre-tax basis to pay for the things that you would be paying for anyway, like healthcare copays, prescription copays, eyeglasses, and other items. You don't pay less for those items, but you do actually get a discount because you're using pre-tax money to cover those expenses.
Sounds great.
Any other changes in benefits?
There are no other changes in benefits. The dental plans and dental premiums will stay the same. We'll still have WageWorks as our vendor in 2010, so no other changes in benefits.
Great. When can we enroll?
Open enrollment starts October 19th and runs through November 6th. It will be online at MyUM. So when you log on to MyUM, you'll be asked to update your personal information, and afterwards you'll be asked a question about flu shots. Once you complete all of that, you'll be able to go in and select your benefits for 2010.
Do I have to go to MyUM to enroll in the benefits?
Yes, everyone must go to MyUM to enroll in benefits, and I'll give you a couple of quick pointers about what you'll see when you get to MyUM. First off, the dental plan election that you currently have will roll over to 2010 since there are no changes to the plans or the premiums. Your flexible spending, however, needs to be elected every single year, so if you want to participate in healthcare or dependent care FSA, you want to do that on MyUM. Short-term disability will roll over, as will your retirement election, but it's a good time to review your retirement election at open enrollment anyway.
But medical does not roll over, correct?
No, medical does not roll over, so you need to elect it on MyUM. If you do not, but are currently covered by a UM medical plan, you will be defaulted into the HRA for 2010. So you want to make sure that you tell us what plan you'd like to be in next year.
If I have any more questions, where can I get additional information?
Additional information is posted on our website, miami.edu/benefits. You'll find frequently asked questions, the examples, some comparison sheets, and of course all of our printed materials are available there online as well.
Well, what if I have a more specific question?
You can go to our website and click on the link to ask a benefits expert, and one of our benefits staff will respond to you as quickly as possible. So thanks for your time today, and remember, take action for your health.